It's time we had a healthy conversation about what it really takes to help all kids succeed in school and in life. And it's not about just exercise and diet, although that's important. This is about digging deeper and giving kids what they truly need to be better learners. To improve learning, shouldn't you focus on reading, writing, and arithmetic? And leave health to the school nurse? To help educators, kids, and schools be more successful, we can't just focus on test taking. We have to look at the whole student, the social, physical, mental, emotional student. Here's a quick analogy. If your child's teacher had a migraine or was preoccupied thinking someone might hurt them after school or couldn't see well enough to read a book, would you expect them to be effective? Same idea holds true for kids. What if instead of listening and engaging, kids are thinking, they simply can't be learning. The truth is, no matter how good the teaching, how interesting the curriculum, or how beautiful the school, students simply will not achieve unless they are healthy, feel safe, and have the skills to handle whatever they may be going through in life. They need to be empowered with resilience, self-esteem, belief in themselves, belief in their future, and a strong moral compass. They need healthy relationships with peers and adults, and they need to be fueled with healthy food choices, healthy breakfasts, a healthy amount of physical fitness, and the ability to make positive choices about smoking, drinking, and sexual behavior. When we focus on developing all aspects of our students, they're not only healthier, they have less behavior problems and have better academic success. Over 36,000 high school students in Colorado said they seriously considered suicide. Over 44% of middle school students reported being bullied at school. And more than 10,000 Colorado kids say they've stayed home from school because they felt unsafe. Research shows regular physical activity improves a student's classroom behavior, achievement, grades, concentration, and attentiveness. Yet barely half of Colorado middle and high school students get the recommended 60 minutes of physical activity a day. We need educators, administrators, students, and the community working together for every child in every school. School wellness teams that help by changing the social climate, addressing physical, emotional, and behavioral needs, creating brain breaks in the classroom, bringing in mobile health clinics, advocating for more school breakfasts and healthier lunches, evaluating progress and using the data to drive decisions. We need open conversations at every level of education about what is really on kids' minds and how we can help them cope, overcome, be strong, and triumph. Some of these things are already in place across our state, but there is so much more to be done. We can work together to bridge the link between health and learning.